As the neurosurgeon on call, what do we do if we have multiple emergencies at the same time? Taking call at a level 1 trauma center, often this situation comes up. To answer this question, if we get called for another patient while we're scrubbed into surgery, I'll have the nurse that's in the room answer the phone call, and then they can pull up images and I can talk to the doctor on call while I'm scrubbed in. Obviously, I only divert my attention away from the patient I am currently operating on as if it's a safe moment in the case to do so. We can discuss that case over the phone to decide what the next step of action of that particular patient's plan of care. So it is not uncommon that while I'm performing surgery on one patient, that I am discussing the cases with other doctors for other patients. Now, the question comes up often is what happens if you have multiple emergencies at the same time and patients that need surgery? I rarely have to call the backup surgeon on call, and in fact, I've only had to really do it one time because we usually will triage the patients that are having multiple emergencies at one time. Triaging patients in medicine is something that we do all the time. So basically, let's say we have 3 patients that are having an emergency. We determine which patient needs attention first and which patient could potentially wait. And in neurosurgery, that means if a patient is actively dying and we can save their life, that patient gets attention first. Kind of like if you had multiple wounded soldiers in battle. If you have someone that's not survivable, but a patient that you can save, you go to the patient that you can save even though this other person may be actively dying. It's what we have to do and decisions that we have to make at game time. And in moments like these, our jobs become incredibly stressful. But the stakes are high level, the decisions are high level, and the care that we provide is high level. So make no mistake, this field can be incredibly hard.